Great. Um, Thanks everyone for joining. This is going to be the info session for pediatric mobile immunization clinics, request for applications. This will be our first info session, and we will have our second and final session on February 13th before the RFA closes. So you can feel free to join both, and there'll be time at the end of the session to answer questions that y'all might have. All right. So I'll just do some brief introductions. I'm Christy Wong. I use she, her pronouns, and I am the program manager for this RFA. Andy, if you want to go ahead, just do like a brief intro.
Sure. My name is Andy Lyons. I use she, her pronouns, and I oversee child and adolescent immunizations program for Public Health Seattle King County.
Phil, I know you're just joining, but if you want to come off mute and do a brief intro.
Hi, I'm Phil Thompson. I'm the contract specialist for King County who is assigned to BSK and who will be the primary point of contact for any questions you might have after this info session.
Thanks. Then we also have a couple of technical assistance providers, and I'll let y'all introduce yourselves when we get to that slide for that. All right. Okay, so today's agenda, we'll go over Best Sites for Kids, what it is, and how it's related to this RFA, an overview of the child and adolescent immunization strategy. We'll go over the key elements of this RFA for pediatric mobile immunization clinics. I'll go over and some overview over all that information, including some data and evaluation tips. And then at the end, we'll have time for questions. But you can also feel free to put questions in the chat, and we'll try to monitor those as well and answer them along the way. Yep, so yeah, feel free to add your questions in the chat. And then this is the contact for Phil. So when you have, if questions come up after this info session, feel free to email Phil at cpress-bsk@kingcounty.gov. This email is also included in the RFA document as well on the front page. So if you don't jot it down now, you can find it there. Okay, so Best Sites for Kids, or you might hear me say BSK. The vision for Best Sites for Kids is we want to see babies born healthy, kids thrive, and young people grow up to be happy, healthy, and successful adults. So this is very much a child-focused RFA, but including the family as well. But the main focus will be children. Best Sites for Kids strengthens families and communities so that babies are born healthy, children thrive, and establish a strong foundation for life, and young people grow into happy, healthy adults. And then Best Sites for Kids equity is a very big focus of this program and this funding stream. So you'll see that sprinkled throughout the RFA document. So we have a child youth advisory board that helps to keep our mission equity focused. And here are the principles of Best Starts for Kids. Our approach is grounded in promotion, prevention, early intervention, and policy and systems change. So I think with this, immunization is very much focused in the prevention principle of Best Starts for Kids. Yeah, so a little more about where BSK, Best Starts for Kids funding comes from. It's a 6-year property tax levy that started in 2022 and goes through 2027. So that's why this RFA, the funding will end December 2027. And then in 2027, this property tax levy will go up for renewal. So we'll see if it gets renewed and move on from there. But right now, this RFA goes from about April 2025 to December 2027. Yeah, and this is BSK 2.0, which started in 2022. So BSK 1.0 started in 2016, something like that, 2016, 2017, and has been around since then. So we've been funding these different programs related to childcare, capital projects, technical assistance and capacity building, homelessness prevention, investing early. So those are focused on prenatal to 5-year-olds, but our strategy focuses is within the Sustaining the Gain program of ages 5 to 24. And then there's a couple other investments as well. So child and adolescent immunizations, we fall under the integration and other strategies. We're a little bit different from other Best Starts for Kids fundings that do a lot of direct services. But with this RFA, we're kind of leaning more on the direct services, getting kids vaccinated. So this might change soon. Okay, so within our strategy, we try to address systemic barriers to vaccine delivery and communities' emergent and changing basic healthcare needs by gathering key stakeholders and implementing quality improvement in pediatric healthcare. So essentially, we really try to bring healthcare to folks, to communities who need it the most, and reduce barriers to vaccine administration. And we do this with 2 different ways. We have youth-led vaccine education and outreach, which I'll go into now. And that strategy focuses on working with young people to equip them with the skills to design and implement health education and outreach campaigns to increase awareness and confidence in adolescent vaccines. And we're hoping that kind of goes hand in hand with our second strategy, which is this RFA's focus, the pediatric mobile immunization clinics, that will expand access to no-cost vaccines in communities that experience inequities due to access barriers, medical discrimination, racism, transportation, language, cost, and other factors. Just a little bit of like brief history about this specific project with mobile immunization clinics is that we have had a similar RFA released through the county in 2022 and 2023, but this is the first year that we're releasing this funding under Best Starts for Kids. So we have a little bit of history of doing this work previously, but this will be the first year that Best Starts for Kids is involved. Okay, so who is this RFA for? We're looking mostly for healthcare providers to provide the vaccinations through mobile vaccinations to youth and families. But we're looking for healthcare providers that are able to work with the communities, especially communities with highest needs and highest barriers to vaccine access. So yeah, definitely looking for healthcare providers who have worked with a wide range of different communities, childcare centers, schools to provide healthcare and vaccines. Feel free to put any questions in the chat, or you can come off mute too and ask questions too. We're a small group.
Sorry, Christy, this is Hakan. You just mentioned that you're looking for healthcare institutions, I presume, to carry on this, take on this FOA. In the FOA, the RFA that came out in there states that could be nonprofit or for-profit companies as well. I just wanted to clarify, it could be any company can apply or request this funding and to support the communities.
Yeah, they just have to be enrolled in the child vaccine program, children vaccine program, I forget the
Yes.
CVP, and be able to provide vaccines is one of the main criteria. Does that answer your question?
Yes, absolutely.
Okay.
I presume that could be collaboration between two organizations as well, could be coming in as one, right?
Exactly. Yeah. I think the
Okay.
main focus is for the primary applicant to be the healthcare provider, but it's also possible that it's a joint application with a very strong community partner who has relationships with multiple different sites. Yeah, we're looking for someone to kind of be able to go to different spots in King County with high need. So yeah, definitely open to some sort of collaboration.
Thank you very much.
Mhm. Okay, so data and evaluation are a really big part of Best Arts for Kids funding. It's how we are able to advocate for more funding and keep our funding stream and keep our stakeholders aware of what's going on in our communities. So we definitely advise folks to add data into their proposals, like really create the story of what you want to tell the reviewers about your organization, your program, and your community. And using data to really tell your story. So feel free to add in the data and that could look like numbers, maps, stories, and pictures to really answer the questions in the proposal, the request for application. And then we'll go into more detail later, but through Best Arts for Kids, there's free technical assistance available for you as you go through this application process. So just be aware of that is definitely a resource that everyone should take advantage of, and we'll go into more details later. Question? Yeah.
Hi, Christy. I believe my name didn't pop up there. My name is Ilango. I'm a pharmacist. And I have a quick question regarding how this works. Like, I am a CVP. I am licensed pharmacist, part of a group of pharmacies. And if I want to contribute to this amazing community effort, and we have a lot of experience in hosting clinics to senior living and also pediatrics as well. So I'm kind of open to either maybe you can educate us or maybe point us to the right direction. How does this work, as well as, like, do you work with somebody as a group who does this, or just an individual provider with a mobile, like a car or something, a van, they drive around and take care of people? So I am sorry, this is a very basic question, but I would love to know from somebody who is aspiring to contribute, to learn more about this. Thank you.
Yeah, thanks, Alonga, for your question. So we are open to partnering with like any healthcare provider, big or small. Kind of will depend on your application and what you write in there, like who you're going to be able to serve, and if that those answers are aligned with what we are looking for that's described in the RFA. So we're looking for someone who's flexible but able to deliver a lot of vaccines to a lot of different folks all over King County, but especially South King County. And we've had previously like smaller partners who are able to do that, not necessarily big healthcare providers. But yeah, Andy, if you want to go ahead and jump in and add to that.
Yeah, I think we've seen, so as Christy mentioned, and I know you came in a little bit later, so I don't know if you caught this, but we have funded, our program has funded a very similar project to this. It was through a different funding stream. But we have seen a number of different sort of partnerships or funded organizations or partnerships work, some of which have been pretty small providers with, pretty small operation, but they've got the CVP access and they're working with communities. We've also had bigger healthcare systems. And both of those systems have worked. So, really the restrictions or expectations are pretty minimal. It's just making sure that we have folks who can have the experience running clinics, have the community connections, or have a plan to cultivate those community connections, and have an idea of being able to serve sort of the highest, the greatest barrier needs communities. I see there's another question too.
Did that answer your question? Do you want to ask any follow-ups for that?
Oh, thank you, guys. Thank you so much. Yeah, that answers my question. I do have more, but I'm kind of like waiting till the end and then ask you more maybe offline. But thank you. That's a great intro. I appreciate it.
Okay, great. Yeah, we'll still have time at the end to answer your questions. So yeah, I would, yeah, jot them down and we'll leave time at the end to answer that one. Marshall, did you have something else?
I do. Thank you.
Great.
So we currently do this work. Well, I guess my question is around the funding. You said that you've dealt with this before. You've done this type of work, different funding streams. Was this funding stream a little bit more than what it is being offered in this RFA? And there's a reason why I'm asking that. And I guess the reason why I'm asking, there's a reason why I'm asking, I won't say, but another reason why I'm asking is, do you anticipate the awardee to keep up the same pace with this amount of funding versus what you had before? Does that make any sense? Okay. Like if you had more funding before and, you guys have put an example in there that the previous person or previous entity did, 70 something clinics over a 1-year period, serving 2,500 plus people. Well, if you have more funding for that, that's something good to know. Or if you had the same amount of funding, it's also good to know kind of where we need to base our projections and budget and stuff.
Yeah, that's a good point. Yeah, I think in previous, what you're alluding to is in previous RFAs, we've offered more funding than the 200,000. But I think we've kind of accounted for that. And in the RFA, there is a portion, let me try to find it exactly so I say the right words, but we have like made a small table of what we think is a competitive number with accounting for the funding that's in this RFA, which is a little less than previous RFAs. So I think we're still shooting for like that, just ballparking those numbers as a competitive application.
It was 25, I believe it was the 25.
Yeah.
Yeah, I just wanted to
And
make sure, yeah, the expectations weren't going to be the same if you had more funding versus, the last time, because you guys threw that example in there. But I don't know if that example should be in there if the funding was more, if that makes any sense, because
mhm.
it's misleading, right? So that was just my point.
That's a fair point. Yeah, so I would just focus on that table of 18 to 25 clinics. But it's also, yeah, it's a competitive process. So we're kind of looking for, the reviewers will be looking for
Who can make
the
the dollar stretch,
applications
right?
that, sorry, say that again.
Who can make the dollar stretch?
Exactly. Yeah.
That makes
Yeah.
sense. Oh, and
Who, and that's not the only criteria either. There's a lot of other factors.
absolutely.
But we just, because we had the data, we just wanted to involve it for folks that maybe have never done this work before and see that these numbers were possible. But every proposal will look different, and we will definitely account for all those differences. And
do you anticipate having more than one awardee?
we anticipate
don't know.
one awardee. We are leaving it open to two, but probably because the funding is what it is, it's not as high as we would hope. We are likely only anticipating one awardee.
And one more question. What would be your role in all of this? I believe you would leave it all up to us for logistics and planning and things like that. Am I correct in that?
Yeah, if you're awarded, the logistics will pretty much be up to the awardee. We have a lot of resources based on what we've done in the past and connections, and can provide support. But it will be, mostly on the awardee to kind of plan all of those clinics. And then with some guidance from the county, but I think it's just a matter of like, as long as you're serving the folks who need the most support, which we've outlined as like defining by tracking SVI data, focusing on areas with higher social vulnerability index, those that will align with the what the county is looking for.
Okay. And when you guys will give us that parameter, or we'll just go off the cuff ourselves, meaning will you guys provide us with data, what we should be going by, meaning like, okay, because if I went to, let's say, Tequila, I believe that's part of, and then there's pockets, right? There's pockets of places where people need help, doing this work. We've gone to Marysville, which is probably low SVI, but there's pockets in there that need help. If we went to those type of areas and performed a clinic, say with the church, whatever it may be, I guess how you qualify that clinic? Will we need to qualify through you, get it approved through you first?
I would say like once we're like in that, as long as it's within King County, there's like certain hard restrictions of like the population served need to be within King County, and yeah, there's some parameters there, but I think that it doesn't need to be like as strict, and like we're not like focusing on like tracking every single little thing here. And I
Okay.
think that's where like the partnership does come in, of like
Mhm.
conversations with the program manager and the awardee to kind of work that out together when there is some things that might not be as clear cut.
Mhm.
So I don't want to say that there's like a hard line of yes, you can do this, no, you can't do this.
Sure.
It's very much a conversation.
Awesome. Thank you so much. Appreciate that.
More blurred lines of service. If that's helpful.
Yes, very, very helpful. Thank you.
Mhm. Andy, if there's anything else to add, feel free to jump in.
Yeah, I will say, you know, we certainly appreciate very much that there are, you know, zip code is an imprecise way to find or understand where there is need, right? It's one tool among many. And we certainly acknowledge that there can be very well resourced areas that have pockets of families who are experiencing really high need or having a lot of barriers. So we do provide or we sort of have an expectation in this grant that the focus is on higher social vulnerability index zip codes to try and sort of maximize the amount of folks experiencing barriers that we can meet. But I think as a program, we understand that there's a lot of nuance to that. So, you know, what we're kind of asking for and expecting in an application and how that's going to work in a practical kind of relationship is a little bit different. So, definitely just want to let you know that we're not, you know, we're not super strict about the you know, the boxes, but we do want to have data and research or whatever kind of resources to back up the decisions we're making and really try to be thoughtful and in our planning and execution.
Thank you.
Okay, we'll keep going. Let's see where we're at. Okay, so yeah, feel free to reach out to BSK technical assistance, more details to come. Using data in your proposal, these are some resources that might help you to find the data to add into your application. I'll add them in the chat. And then I believe this PowerPoint will also be posted so that you have access to that too. Okay. Okay, so these next slides about performance measurement will be for the awardee. So you don't need to worry too much about this in your application process. So if awarded, all programs will participate in a performance measurement and reporting activities, which will include quantitative and qualitative data to share your program's impact. So this data is kind of goes at all Best Starts for Kids awardees are required to have performance measures and an evaluation plan, and that will be there will be an evaluator assigned to your program, so you don't need to worry about coming up with that all yourself. There'll be a lot of support, but just awareness that that is one of the requirements for awardees. Here are some of the data that you'll be expected to submit. So there'll be bi-monthly progress reports and invoices, and then more general like performance measures data quarterly, and annual reports. Okay, so here's a summary of the RFA. I think this date is wrong. Actually, it's the 27th. So funding available is 200,000. Applications will be due, it's a Thursday, February 27th, by 2 p.m. The contract period will be from around April 2025 to December 31st, 2027. That just depends on contracting and how long that takes, but that's our hope. Yeah, and the limit to request will be 200,000, so that you could request less than that. And yeah, like I said before, we're anticipating mostly one award. Two is leaving the flexibility for two, but likely just one award. Yeah, and here's the timeline of some important dates. This is all in the RFA, so feel free to you don't need to memorize this, just refer to that document. Then this is our first info session. We'll have another info session February 13th. February 21st is an important date to submit questions, your final questions to Phil at that cpress-bsk email address, or request technical assistance for your application. And then application due date will be Thursday, February 27th by 2 p.m. But hoping that folks submit their application a little before that, just in case there's some hiccups with Zoom grants. Yeah. Then potential contract start date might be April 15th. Sometime in April is what we're hoping for. Okay, our funding priorities are: we're seeking an organization who has experience hosting mobile vaccination clinics and a successful history working with diverse communities. The program should have the ability to be flexible and respond quickly to the needs of communities that have limited access to healthcare. So all the applications will be reviewed by our review panel. So that doesn't include me or Andy or anybody who has had a hand in writing this RFA. It'll be yeah, a review panel who will be following the scoring rubric that was provided to you all, and the proposals will be going through a formal review process. There's also an appeals process outlined in the RFA. Okay, so the application materials, it's a little confusing because we are running this through Zoom grants, but because of some issues with Zoom grants, we thought it would be easier to submit the application questions through just a Word document. That'll be easy for you all to complete than inputting it into Zoom grants. So what will happen is you'll complete the application packet, which has the questions and the rating criteria, project work plan and references, and then a separate document of the budget template, which is in a spreadsheet. And you'll submit those documents into Zoom grants. But you won't need to be typing anything directly into Zoom grants. You'll just submit those, upload those documents. And yeah, for your...
Sorry to interrupt real quick. I couldn't find the button to raise my hand. apologize to interrupt. I'm on Zoom right now, which I faced actually this issue when I was brought over this application. There's no area, there isn't any place where we can attach those documents once we fill them out. Is this going to be available soon, or is that something that is a glitch on my end?
I'm not as well versed in Zoom grants. I don't know if Phil has any answers to that. But let's see. But we can, yeah, go ahead, Phil.
I do. So there should be a screen that has documents. It specifically calls them out and says required or mandatory documents. When you're looking at it from the applicant view.
So I see the tabs up there. It says like description, and then what is it? Restriction. Then it says library, contact admin, but there's nothing in there where it shows the application itself. Under the library shows me all the applications where I got the RFA, but those are just attachments. There's no place for us to attach what we downloaded.
Okay, so when you're at the library, just below the list that should say, you should say acceptance of terms, PHSK, standard terms, the budget template, the descriptions, technical assistance.
Yes, I see
Okay,
that.
just below that and to the right, there's a button that says submit now.
Correct. Which when I click here, it says attach, and it gives me activity log. Is that what it is? I don't...
Yes. Oh, okay. I see what you're saying. It just warned me that this is open and not to touch it. So I think you have to start by initiating an application. And then as part of the application process, you'll see, because that list that you and I are both looking at, that's the general library, which isn't the same as the required documents. So the acceptance of terms and conditions, that budget template, those are the library. If you actually go in, create an account, and start an application, then it will drop the required documents to you, and you will be able to upload those. If you get to that point and you've generated or started to create an application, and you don't see those, you can email me or you can call me, and we can walk it through together.
Yeah, I think I brought the application here. Even on Zoom, it says incomplete application, which is already in here for this RFA, but I'll follow up with you separately. It won't take more time here. Sorry. Thank you very much.
Great. So yeah, make sure to utilize Phil's email if you have questions like that. He is, for in my eyes, the Zoom grants expert. So all right. Okay, yeah, so be sure to kind of, Zoom grants is not the easiest to navigate, so be sure to kind of take a look at all that stuff way well in advance, and try to upload all your documents before the deadline, because Zoom grants could be slow and it's not super user friendly. So yeah, if you have questions about that, make sure to reach out before that February 21st deadline. So some budget tips. Budget should be developed for the length of the contract term, which is the end of December 2027. If you're applying as one organization, you'll only need to use the just that one budget and label it lead applicant. If multiple organizations are applying to the partnerships as a partnership, please detail your individual budgets. All right. Great. Yeah, and all the budgets, all the funding needs to be spent before December 31st, 2027. Okay, so yeah, technical assistance will be available to support applicants and eliminate barriers that might prevent you from seeking funding. That assistance is available through February 21st. That's the deadline to seek out a technical assistance provider. There should be a document along with the RFA that outlines your technical assistance provider list. But some of them are available today to kind of give a brief overview or answer some questions that you might have. So I'll go ahead and pass it off to Angela. Maybe you want to go first and introduce yourself.
Thanks for being on this lunchtime meeting on a Friday. My name is Angela Silva, and I'm with Collaborative Partners Initiative. And we are a newer technical assistance provider, but excited to be here and provide guidance on your application and how to best address the questions, maybe even how that might look as you upload that into Zoom grants. Again, we are here to kind of add that finesse to your application and be a resource to you. So if you're looking for technical assistance, you will have a choice of providers. We hope you'll reach out to us if you're interested in working with us. And we're happy to be here and provide assistance. Thank you.
Amy, did you want to introduce yourself?
Yeah, I'm Amy Kawai. I'm from Communities Rise, and we offer a range of legal and capacity building resources to nonprofits. And through this, yeah, as Angela said, we're offering technical assistance on grants. We particularly focus on like really small organizations, particularly if you're 500K or less in budget size. But also we have exceptions for that. And so feel free to reach out and we can hopefully connect.
Thank you. Yeah, so technical assistance is completely free. So y'all should take advantage of that. There should be a list of the different providers you have access to and their different specialties. So you can just choose anyone you want to reach out to, and you can directly reach out to them, and they'll support your application with editing and budget review. But just remember that technical assistance is not grant writing. They are not writing it for you, but they will help you along the way.
Will they support nonprofit and for-profit if they apply, or just nonprofit? Sorry, questions for Amy and Angela.
It's a good
We
question.
can work with any type of organization, and we specialize at getting funding for organizations that haven't had large dollars before. So for-profit, nonprofit, etc. We are a small business ourselves, so we can work well in either lane. And also, if you're looking to partner with other types of entities, we're really good at helping kind of piece all those pieces together, so you can operationalize the work that you're looking to do for this RFA. Thank you for your question.
Yeah, that's a great question. And we also work with small businesses, so totally fine. I think in the past, we have mostly worked with nonprofits through this partnership and contract, but that does not mean that we're excluding small businesses. We're more about the size of the small businesses. So how we categorize that is slightly different for-profit and nonprofit organizations.
Perfect. Thank you very much.
Great, thanks. Any other questions for our technical assistance providers? Like I said before, there's a whole list. So thankful for Angela and Amy for joining in to answer a couple questions, but there are also other providers available. So you can pick and choose what matches the needs of your organization and application. Great. Okay, so yeah, here are those last little details. So make sure you email questions to Phil at cpress-bsk@kingcounty.gov. You're also welcome to join our next info session if other questions arise that you want to talk through. That'll be February 13th. So welcome to join that as well. Yeah, you can contact the technical assistance providers directly. Yeah, and then there's a checklist with the application just to make sure there's a couple other things on there to make sure that you complete before submitting. So make sure to look at that. All right, we have about like 10 minutes for questions if there's anything else that came up. We'll be creating a FAQ with all the questions asked and uploading that to the RFA, I believe. It'll be sent to y'all, and so that you have a record of all the questions that were being asked related to this RFA. But any other questions?
So Christy, as far as leads are concerned, sorry if I missed this while you were talking about this leads. Are you providing them, or it's up to us to get the leads and then take care of those community in need?
I don't quite understand the leads of what are you
So,
referring to?
yeah, like say if you have a community with a school district that needs our services. So if it's something that you provide the leads, like those contacts, so that we can go and offer the services, or we need to hunt for them.
Yeah, I think we're looking for folks who have like relationships with different communities already. But yeah, I think that if you are looking to start making those connections, that's something that is on you as the applicant to figure out. I think after like we choose the awardee, then that's when we start to work with the awardee to kind of like add more specific connections if needed. But before that time, I think it's on the applicants to seek out those relationships and yeah, see if that's, yeah, to work in those relationships before.
Thank you. So I meant to, probably I didn't clarify this. So after becoming an awardee, and yes, of course, we do have our own community and connections based on what we do as a provider. And does King County prefers to take care of, those communities that they have figured out that they have needs, or we are on our own to just take care of those and then give you the performance of 18 or 20 clinics that we have done? That's what I meant to ask.
Got it. Yeah, I think what usually happens is that the awardees kind of figuring all of that stuff out on their own, of like working with communities separately. And what often happens is that different communities might reach out to us directly and saying, hey, we have this need. And then at that point, that's when we connect those communities to the mobile vaccination provider to say like, hey, we have this. We're kind of like just another way to get more to just another yeah, another way for you to build those connections. But I would say usually that's what happens. I think that's what's happened in the past.
Got it. Thank you.
And just to one last question to follow on excuse me, on what Ilango asked. In terms when it comes then to vaccines, is the vaccine provided or paid for, or how does that work? Or the funding is for the vaccine cost?
So yeah, the main requirement is for the applicant to be part of CVP, the Child Vaccine Program.
Okay. And then they get the vaccines from there?
Yeah.
Okay. Got it. Thank you.
Mhm. Any other questions? Okay. Thank you all so much for joining our info session. And yeah, I hope this was informative. And yeah, please reach out to Phil if you have any questions after this info session. And then please reach out to our technical assistance providers too, if that's interesting to you. But other than that, thank you all so much.
Thank you.